All right. Uh, Hi, this is Paul Reich, the Behavioral Health Program Manager at Tri-County Health Network, and I am joined by my colleague, Corinne Cavender, our Behavioral Health Operations Coordinator. Welcome to another edition of Mental Health Matters Access Show here on KOTO. We are hosting these shows on the third Wednesday of every month on KOTO to highlight resources and programs available in our community around mental health. Interviews will be posted to our website at tchnetwork.org following the broadcast. And we're excited to have you join us today on KOTO. And thank you to the KOTO News Department and Ben Kerr here at KOTO for making this possible. Corinne, who's our interview with today?
Segment of Mental Health Matters, we are joined by Shelley Fourney from the Uncompahgre Medical Center. Thanks for being here, Shelly.
Thanks for having me.
You're welcome. Thanks, Shelly.
So first, we want you to tell us a little bit about yourself, your position, how long you've worked with UMC, past positions, education, whatever you think is relevant for the community to know.
Okay. So I work at Uncompahgre Medical Center and as a behavioral health provider, which is just, for a simpler way of putting that, I just tell people that my job is just to work with them around functioning well in their everyday life. And that can cover a variety of different things. And so definitely I look at helping people function at their best. I've worked at UMC 6.5 years. And I've worked, prior to that, I was at home with my kids for quite a while. And then we lived in Maryland and Ohio before coming here. So I worked in Ohio at a private mental health agency and then with kids. And then back even further in Maryland, I worked a variety of different positions, but an aide in a school at one point. I worked for a local health department doing one-on-one counseling with kids. And so that's just a little bit of my history.
Well, that's a long history. Not to date you, but that's a long history, Shelley.
It's been a while. So yeah. So I have my master's in social work and a license as a clinical social worker in Colorado.
Okay.
So to build off of that, the reason we have you here today is to learn more about the behavioral health services that are offered at UMC. Would you explain the offerings that you guys have?
Yeah, definitely. So I often like to explain to people that I work with folks wanting to set goals, lose weight, manage pain, those that need parental support around parenting their own kids, grief, stress, sleep, mental health concerns, anxiety, depression. I also often help if I can't help with a certain service, I will connect them to a service. We also do Acupuncture Detox, which is 5-point ear acupuncture. I'm not trained as a complete acupuncturist, but I can do 5-point ear acupuncture. It often will help with things like pain, mood, sleep, relaxation in general. So it's just an alternative treatment that can really help folks around managing anxiety, stopping smoking. I'm trying to think what else. Like sometimes it's really been helpful with like migraines, pain, that kind of thing. And everybody's response is a little different. So it's sometimes hard to tell how somebody's going to be impacted, but definitely our patients are finding it useful.
Interesting. Yeah, thank you for that. I really liked the way you phrased it in your opening answer about helping people functioning well in everyday life. We teach mental health first aid, and parents, when we teach the class for people who work with young adults, they're like, well, when should I be worried? Or, just in general, we always kind of frame it around, when it impacts your ability to live, laugh, and love.
Yep.
But I like the way you phrase that of helping people function.
Right.
So it's a little bit unique what you do. So, I mean, I've seen therapists, but it's always been, kind of make an appointment, go see them in their own office. It's a little unique what you do at UMC, where you're working alongside the regular docs and PAs out there. Why is that beneficial? And how does that look different than what many people might have experienced?
Yeah, I feel like it's been really beneficial to, one, kind of normalize the fact that everybody at some point is likely to need some additional help. I have a therapist that I talk to. I have people that I call on when I need some extra support or some advice or some input or ways to move forward. And so the beauty of this is that I get to go into a room and work with somebody for a couple of minutes or in a little bit longer period of time in hopes to help them move forward in whatever it is they're managing at the time. I do some individual appointments, but that's not predominantly my main focus.
Yeah, I would imagine, given, there's still so much stigma and so much, people are still so concerned about seeing a mental health therapist. Sometimes they don't feel comfortable. And I would imagine there's some comfort in knowing that, they're going to the medical center, and that could be for any reason, not just to see you.
Yeah, we've actually, I don't know if this is good or bad. I think it's a little of both, but I've had a situation before where somebody didn't realize that that's actually what I did, because that's not how I introduced myself.
Interesting.
And so I want to normalize needing help so that it's something that everybody feels is accessible.
Yeah. So do I need to see a regular doc first at UMC to see you, or how does that work? How can I come and see you, or how do I get to see you?
Well, so if you're a patient at UMC, 100% you have access to this service. If you're a patient in dental or medical, it doesn't matter. So that's probably the first thing. If you are not a patient and you think it's something you want to pursue, we do ask you to establish with a medical provider. That's kind of how we essentially open the chart, if you will, but it's definitely easy to do that. We will make that happen. And so I don't typically open a chart to set up seeing someone individually, because my primary focus is an integrated appointment, which just means I'm in the room with the patient and the provider. And so we would just say, hey, let's set up an integrated appointment. Shelly can join, the medical provider can join, and we can talk about what's needed to kind of meet your needs at this time. And we'll kind of help them sort it out. If it looks like it's something we can manage in an integrated way, we'll do that. If it's not, and I can see them, I will do that. If neither of those are options and we feel like they need maybe a different service, I will connect them to the service also. Yeah.
Incredible, Shelly. Sounds like you guys really have established a holistic outlook on mental health and physical health, which is definitely something we believe in as well. So it's super cool to hear about what you guys are doing.
Yeah.
You mentioned the connection with the primary care. So that leads us into thinking about paying for treatment. So can you talk to us about how that looks and if you take insurance and any details you can give us?
So we definitely, we take Medicaid, Medicare, private pay, sliding fee scale. And then the way we work it at UMC is those, whatever their method of payment is, we take that method. We bill that method. If there's an additional cost to the patient at this time, the patient does not see that. We take care of that. So
because of COVID?
It has always been that way.
That's amazing.
At UMC, there's no cost to the patient. And so that's definitely something that we're kind of weighing and evaluating at this time. Still no cost to patients. Yeah.
Wow. That is super good to know and super admirable for your organization. So to kind of expand off all these services, can you tell us why you think your programs benefit the behavioral health outcomes in our community?
I think that we make getting help easy, and we also make it less stigmatized to do that. I think that people feel comfortable They're here, they've already established a relationship. If they need some additional help, we try to make that as easy as possible to do that.
So I'm curious, I mean, during normal times, what have you seen as the issues within your community that are common? And I guess, has that changed in the last 9-10 months since COVID, since March?
You know, I keep thinking about this question, and normal, in normal times, I would say stress, grief, substances, depression, anxiety, other mental health concerns, parenting needs, and I would add housing. Housing is a real thing, and it's been a struggle. I don't feel like we have seen a drastic difference with COVID. I have seen an increase in anxiety, and at the same time, there's been a lot of times where I've had availability on my schedule where I normally wouldn't.
Interesting.
And I think I've been trying to figure out, like, why is that? And I think a portion of that is, people are hesitant maybe to come into the clinic because of COVID, but
Sure.
I would definitely mention that we are taking every precaution right now, and the patients with symptoms aren't being seen in the building at this time. So I feel like I can definitely say it's safe and it's accessible, and I have access to do Zoom appointments. Definitely our preference is to see somebody in person where possible, but we have Zoom as a backup, and there's really no reason not to get help if somebody needs it.
Yeah, no, thank you for that. I mean, that's obviously the three of us believe that, and we hopefully those listening will take that to heart and recognize that, sometimes it's kind of like just getting your car tuned up. You don't wait until the transmission has failed before you get your car serviced. And so I kind of like that analogy I've heard others use around just, it's good to just get a checkup now and then. And it's good to know also that you said you can do it via Zoom if somebody chose to have just like this, to have a session virtually as opposed to in person.
Yeah. And I think, even though we've seen some level of increased anxiety, I've also been pretty amazed at the resiliency among our patients. It's just been impressive.
Yeah.
Something else that came to my mind was one of the beauties of integrated care is we don't have to wait until somebody's in a crisis.
Mm-hmm.
Sometimes it's not uncommon for a patient to mention to their medical provider they've had some additional stress. And so I can be included in that appointment. We can talk through some things, maybe do some brief interventions to kind of help get them headed in the direction they want to go, as opposed to waiting until we're in that crisis level. And I think that's a huge piece.
Sure.
Shelly, I want to circle back to your Acupuncture Detox program. I have a couple questions. One, can you just describe it a little bit more? And then, is it available during COVID?
Yes, so it is available during COVID. We do 5-point ear acupuncture. And so that is using very small, fine needles in 5 points on a person's ear. We usually have them clean. And then I will put those needles on their ear, and then they are able to kind of, usually we give them about 30 minutes to lay down if possible. If we have a room available, I'll let them lay down on a patient bed and have about 30 minutes, and then we'll pull those needles out.
What's normally, you said there's varying results, but if it's, the most successful that it could be, what does an outcome maybe look like?
I would say most successful is, I don't have any more, my headache's gone. I usually have headaches every day. If I'm doing Acupuncture Detox, I'm not having them. Another scenario would be, man, I'm completely calm as opposed to feeling really ridden with anxiety. And my sleep's a little better. In general, I was able to cope better through the week, make better choices. I think ideally so this is one that, I'll just be honest, we often do it for smoking cessation. And then, yes, I've heard, I'm not smoking anymore, but often those people don't come back. So we don't always know it, they don't need us anymore. And I'd like to assume that's good things.
Sure.
Right.
I'd like, can you just let us know if you've been successful? So, yeah. I think it definitely helps manage the cravings.
Yeah. Very cool. Well, to kind of wrap up, is there anything else you want people to know about the services you guys provide?
One thing I forgot to mention is we do a wellness group every other week on Wednesdays, from 1:30 to 2:30. And that is an open group. People can join. If they're patients of UMC, they're welcome to be part of that. They just have to call UMC to get that information. So, other than that, I don't have anything to add, but definitely you can always call UMC to get in touch with me, or if you have questions, I'd be happy to give information or just talk a little more in detail.
For being here today, Shelly. And thanks everyone for listening. If you are interested in behavioral health services or their integrative services through UMC or other providers in San Miguel County, the San Miguel Behavioral Health Solutions Panel has funds available. So like Shelly was saying, there's no reason to wait until the last minute to receive services. So if you need help funding anything, please visit sanmiguelbehavioralhealth.org. Shelly, is there a good number that people could reach you at UMC?
Yep. So just call the UMC's front desk at 327-4233.
Thank you. And please join us next month, February 17th, for the next edition of Mental Health Matters. If you are interested in learning more about the behavioral health programs at Tri-County Health Network, please email us at info@tchnetwork.org or call our offices at 970-708-7096. Thanks and have a great night.
Thank you, Shelley.
Yeah. Thank you. Have a great day.